Why does ART drug resistance happen in HIV treatment? Imagine trying to stop a moving train with a single rope. That's similar to how HIV can sometimes outsmart antiretroviral therapy. The reason for this is that HIV has a very high mutation rate, which means it can change its genetic makeup quickly. These changes can make the virus less affected by the drugs designed to stop it from multiplying. When someone takes their medication irregularly or misses doses, the virus gets a chance to replicate in the presence of lower drug levels. This creates an environment where resistant strains can develop and become dominant. HIV replicates rapidly, and each time it makes a copy of itself, errors can occur in its genetic code. Some of these errors lead to mutations that alter parts of the virus targeted by drugs, like reverse transcriptase or integrase enzymes. For example, mutations in reverse transcriptase can make the virus less vulnerable to drugs called nucleoside reverse transcriptase inhibitors. These mutations can either reduce the drug's ability to bind or help the virus remove the drug from its DNA chain, allowing the virus to keep copying itself despite treatment. Using incomplete or ineffective treatment regimens also plays a big role. If a person is on a regimen that does not fully suppress the virus, or if they are only taking one drug instead of a combination, the virus can survive and adapt. This is why combination therapy is so important. It makes it much harder for the virus to develop resistance because it would need to mutate in multiple ways at once. Resistance can also be transmitted from one person to another, which is called primary resistance. This means someone can get infected with a strain of HIV that is already resistant to certain drugs. Resistance can also develop during treatment, known as acquired resistance, especially if the person does not follow their prescribed regimen closely. When resistance happens, it can lead to treatment failure, meaning the drugs no longer keep the virus under control. This results in higher viral loads, faster disease progression, and increased risk of transmitting resistant strains to others. To prevent this, healthcare providers emphasize the importance of strict adherence to medication schedules, regular viral load testing, and resistance testing when treatment isn't working as expected. If resistance is detected, switching to a different, more effective combination of drugs is crucial. In the end, HIV's ability to mutate and adapt is a natural part of its biology, but careful management of treatment and consistent medication use can help keep resistance at bay. It's always best to work closely with healthcare professionals to develop a personalized treatment plan that minimizes the risk of resistance and supports long-term health.